Next is we are going to perform the physical assessment of the ears, or the physical examination rather. Okay? First procedure we have in ears is we need to inspect the auricle, tragus, and lobule. We need to note for size, shape, and the position of the ears. Okay? Ma'am, I'm going to inspect your ears. Is it okay?
Yes.
Okay. Okay. Next, the other one. Can you look upward, ma'am? Okay. So, based on my inspection, the ears are equal in size bilaterally. The auricle align with the corner of each eye. Okay? And within a 10-degree angle of the vertical position. The earlobes are tightly attached to the adjacent skin with no apparent lobe. No abnormalities such as microtia or ear malformation. Next procedure is we are going to palpate the auricle and mastoid process. Ma'am, I'm going to palpate your mastoid process and the auricle. Is it okay?
Yes.
Okay. Is there any pain, ma'am?
No.
How about the other one? Is there any pain?
No.
This one, is there any pain?
No.
Okay. So as I palpated the auricle, tragus, and the mastoid process, my client didn't complain any pain or tenderness. Next is we are going to inspect the external auditory canal, and we need to note for any discharge along with the color and consistency of the cerumen. Ma'am, I'm going to inspect your auditory canal, which is inside your ear. Is it okay?
Yes.
Okay. I'm going to use a pin light. Okay. Very good. The other one, please. Alright. So, based on my inspection, there is a little amount of cerumen, which is very normal in a client's ear. And its consistency is soft. Next procedure is we need to perform the whisper test. Okay? In this procedure, we need to ask the client to gently upload the ear which is not being tested and rub the tragus in a circular motion. We need to whisper a 2-syllable words and ask our client to repeat it back to you. Okay? Ma'am, I'm going to give you a 2-syllable word. Okay? Alright. While I'm uploading your ear. Okay? Can you hear it, ma'am?
Yes.
What is it?
Jackson.
Very good. The other one? What is it, ma'am?
Johnson.
Very good. So, based on the performance of my client, she is able to correctly repeat the 2-syllable word as whispered. There is no indication for hearing loss. Next is we are going to perform the physical examination of the mouth. Okay? First procedure we have is we need to inspect the lips. Okay? We need to observe the lip for consistency and color. Alright, ma'am? Okay? The color, consistency, alright. So, based on my inspection, the lips are smooth and moist, without lesion or swelling. No indication for pallor, bluish or cyanotic lips, and swelling of the lips or edema. Next procedure is we need to inspect the teeth and gums. Okay? We need to ask our client or patient to open the mouth. Note the number of the teeth, color, and condition. Note any repairs such as crowns and any cosmetics such as veneers. Okay? Ma'am, I'm going to inspect your teeth and gums. Is it okay?
Yes.
Can you open your mouth for me, please? Alright. So, to see it clearly, I'm going to use a pin light. Okay. Your gums. Open it, ma'am, widely. Alright. Alright. Okay. So, based on my inspection, my client has a 32 teeth, which is very much normal in an adult client. Okay? No decayed areas, no missing teeth, no repairs, and not using any cosmetics. The gums are pink, moist and firm with tight margin to the tooth, no lesion or muscles. Next procedure is we are going to inspect the buccal mucosa. We are going to use a pin light and the tongue depressor, which is this one. Okay? This is used to retract the lips and the cheeks to check the color and consistency. Again, we are going to inspect the buccal mucosa and the stensil duct. Ma'am, can you open your mouth wide for me? So, this is the tongue depressor. So, I'm going to hold it here. And my pen light. Okay, ma'am, can you open your mouth for me? Alright. The other one. Alright, the other side, please. Okay. Alright, very good. So, the buccal mucosa of my client is pinkish, smooth, and moist without lesion. There is no indication of leukoplakia, candida albicans, Colpic spots, and the canker sores. The stensil duct has no redness, swelling, pain, or moistness in the area. So everything is normal, everything is fine. Next procedure is we are going to inspect and palpate the tongue. Okay? We need to ask the client to stick out the tongue and inspect for color, moisture, size, and texture. We need to observe the fasciculation and check for midline protrusion. Also, we need to palpate for any lesion or masses. Okay, ma'am, can you pull your tongue out? Alright. So I'm going to use my pin light to see it clearly. Alright. Okay. The side of the tongue. No, pull it out, ma'am. The other one. Alright. Okay. So the tongue, the color of the tongue is pink. It is moist and moderate size with the papillae present. There is no lesion or masses observed. Next is we need to assess the ventral surface of the tongue. We need to ask our client to touch the tongue to the roof of the mouth and inspect the ventral surface of the tongue and the area under the tongue, okay? Like this one. Ma'am. Okay. Okay, ma'am, can you pull it up and put it in the roof of your mouth? Okay, there is a vein, normal. Alright. Okay, very good. So, based on the assessment, the tongue of a ventral surface is smooth. It is shiny, pink with visible veins, and no lesion. No signs of leukoplakia, ulcers, nodule that may indicate cancer. Next procedure is we are going to inspect the side of the tongue, okay? Alright. Ma'am, can you pull your tongue out? Okay, your tongue. I'm going to use a pen light. Pull it out. The side, okay. The other one, please. Okay, pull it out, ma'am. Alright. So based on the inspection, there is no lesion, ulcer, or nodules are apparent. No signs of canker sores and leukoplakia. Next procedure is we are going to inspect the hard and soft palate and the ovula. Okay? We are going to ask our client to open the mouth wide while we are using a pen light, okay? To look at the roof, okay? Observe the color and integrity. Okay, can you open your mouth wide for me? Okay, I'm going to inspect the hard palate and the soft palate and the ovula. Okay, ma'am? Okay, very good. So based on the inspection, the hard palate is pale and there is a wrinkled-like folds. While soft palate is pinkish, movable, spongy, and smooth. Okay? The ovula is fleshy, solid structure that hangs freely in the midline. No redness or exudate from the ovula or soft palate. Next procedure is we are going to inspect the tonsil. Using a tongue depressor to keep the mouth open wide, inspect the tonsil for color, size, presence of exudate or lesion. Rate the tonsil for A+, 2+, 3+, or 4+. Okay? Ma'am, can you open your mouth for me? So I'm going to check your tonsil. There is. I'm going to use a pen light to see it clearly. Okay. Okay, very good. Based on the inspection, I haven't observed any tonsil and it is normal. My client is free from tonsillitis. Next procedure is we are going to inspect the posterior pharyngeal wall. Keeping the thumb depressor in place, shine the pen light on the back of the throat, observe the color of the throat and know any exudate or lesion. Okay? So I'm going to put this tongue depressor and shine the light on your pharyngeal wall. Okay, ma'am, can you okay. Alright. Based on the inspection, the throat is pink without exudate or lesion. No indication for pharyngitis. Next is we are going to perform the physical examination of the nose. Okay? The procedure or the first procedure in the nose is we need to inspect the external nose. We need to note for the nasal color, shape, consistency, and tenderness. Mom, I'm going to inspect and palpate your nose. Is it okay?
Yes.
Okay. Can I touch you? Is it okay?
Yes.
Okay. The other side, please. Okay. In the middle, let's see if it's symmetric. Alright. Can you look up for me? Alright, can I palpate? Is there any pain, ma'am, when I palpate your nose?
No.
Alright. So, basically, based on my inspection and palpation, the color of the nose is the same as the rest of the face. The nasal structure is smooth and symmetric, okay? The client reports no tenderness or pain, so therefore there is no signs of local infection. Next procedure is we need to check the patency of airflow through the nostril by occluding one nostril at a time with asking the client to sniff or exhale. Okay, ma'am, can you occlude your side of the nose? Then inhale, exhale. Another one, please. Inhale. Exhale. Okay, very good. The other side, please. Inhale. Exhale. Inhale. Exhale. Okay, very good. So, based on the performance of my client is able to exhale through each nostril while the other one or the other side is occluded. Okay? There is no signs of swelling, rhinitis, or foreign object obstructing the nostril. Next procedure is we need to inspect the internal nose. Using a pin light, we need to ask our client to tilt his head back, okay? We need to check the color and obstruction. So I have here with me my pin light. Ma'am, I'm going to touch and inspect your nose, internal nose. Is it okay?
Yes.
Okay. Can you tilt your head back? Okay. Okay, no obstruction. Color. Alright. So based on the inspection, the nasal mucosa is dark pink. It is moist and free from exudate. No signs of allergies. Alright, next is we are going to perform the physical examination of the sinuses. So in this procedure, we are going to palpate on the frontal and maxillary sinuses. Ma'am, I'm going to touch you. Is it okay?
Yes.
And tell me if there is any pain. Is there any pain, ma'am?
No.
Alright, how about that one?
No.
Alright. The maxillary. Is there any pain?
No.
How about that one?
No.
Alright. During my assessment, the frontal and maxillary is no tender or pain. My client or patient didn't complain for pain or tenderness. No evidence of crepitus, no signs of acute bacterial rhinocytosis, and upper respiratory infection. Lastly, we are going to perform the physical examination or assessment of the neck. Okay? So, we are going to inspect the neck and palpate the trachea. We need to ask our client to slightly extend her neck for the observation of the position, symmetry in lumps or masses. Okay? I want you, ma'am, to slightly extend your neck. Okay? Alright. It is in the middle. Alright? Ma'am, can I touch you? Is it okay?
Yes.
Alright. I'm going to touch the trachea if it is in the midline. Okay. Okay. Ma'am, I'm going to... Is there any pain, ma'am?
No.
This one, is there any pain?
No.
Alright. So, based on my inspection and palpation, the neck is symmetric, with the head centered and without bulging masses. There's no signs of quitter. The trachea is in the midline. Next is we are going to inspect the movement of the neck structure. Okay? So I'm going to ask my client to swallow or small sip of water. Observe the movement of the thyroid cartilage and the thyroid gland. So ma'am, I want you to sip a little amount or take a little amount of water while I am observing your thyroid gland and thyroid cartilage. Okay?
Yes.
Alright. Another one, please. Okay. The thyroid cartilage and the cricoid cartilage move upward symmetrically as the client sips a water or take a little amount of water. Next procedure is we are going to inspect the range of motion, okay? So we are going to ask our client to turn the head to the right, left, up and down, and rotation, okay? Ma'am, I want you to turn your head to your right, to your left, up and down, and I want you to rotate it, okay? Okay, I want you to turn your head to your left side, okay? Very good. The other side, up, down, and I want you to rotate it. Okay. Alright. So my client can move his neck smoothly, no indication of stiff neck, muscle spasm, inflammation, cervical arthritis. Next procedure is we are going to palpate the lymph node. We are going to note for swelling, tenderness, and enlargement. Okay? So ma'am, I'm going to palpate and I'm going to touch you. Is it okay?
Yes.
Okay. Once I touch you, once I palpated your lymph nodes, tell me if there is any pain. Okay? Alright. So let's start first on the preocular. It's over here. Is there any pain, ma'am?
No.
Alright. The posterior or the post-auricular. Is there any pain?
No.
The occipital, ma'am. Is there any pain?
No.
How about the parotid nodes? Is there any pain?
No.
Okay, the tonsillar or the retropharyngeal nodes. Is there any pain?
No.
Alright. Submental. Is there any pain?
No.
The submandibular, ma'am. Is there any pain?
No.
Let's see your posterior cervical nodes. Is there any pain?
No.
How about your anterior cervical nodes? Is there any pain?
No.
Let's see your clavicular nodes. Is there any pain, ma'am?
No.
Alright. So, based on my observation, based on the palpation, my clients or patient didn't complain for tenderness or pain. There is no enlargement of the lymph nodes.